Hi guys, Nick Tunbridge here, Stutter Coach, with my first video, which is going to be on speech treatment, what speech treatments are available and how you choose one, and your speech therapist, how you choose the speech therapist that will be the best speech therapist for you. Just before I kick off, I want to just quickly recap on my books. Stutterer's Survival Guide Volume 1 and Stutterer's Survival Guide Volume 2. Both these books are available on Amazon as ebooks. They're about $9 each. Volume 1 is about learning a speech treatment, going through an intensive program. In my case, it was speech reconstruction. I'll talk more about that in a moment. And how you take those newly acquired skills that you learn in the clinic and apply them in your daily life. The second book is on building communication skills and establishing rapport with people despite having a stutter. Some tips on managing anxiety, chapter on current research into stuttering, genetics and so forth. And I also have a chapter which is dedicated to an interview that I did with one of Australia's leading speech therapists, and it talks in detail what I'm going to cover off very quickly in this video. So look, if you have interest, go check them out. If you do buy them, please send a review through. I'm always interested in what people think, and hopefully they can be of use to you and be part of your fluency toolkit. Okay, so speech treatments, in my opinion, there's only two. There's either speech reconstruction or there's stuttering modification. So speech reconstruction, so both those programs typically are held by both speech research and stuttering modification, are administered by professional speech therapists. Speech reconstruction, which is the treatment program that I've typically done, is where you go to typically a clinic environment and you have an intensive course. And that can be even a live-in arrangement up to 9-10 hours a day for between 5 and 14 days. So it's a very intense, and in fact the speech therapists used to call that the intensive program. And speech reconstruction is really about reconstructing your speech. So they talk about things such as linking your words together, managing hard contact sounds, stretching out vowel sounds, and how many syllables you should speak on a breath. So taking those aspects to give you an example, if we use the sentence, Saturday will be a sunny day, and I choose that because I always have trouble with S's, using speech reconstruction, that would sound like this. Saturday is going to be a sunny day. So you can hear a linking of air and a linking of sounds through that sentence. And when you get into trouble or you have a difficult sound and stretching the vowel, you would make that, for example, rather than Saturday, you might go Saturday, and you're stretching that sound out. So it takes a lot of time and a lot of work to really adopt that new speaking technique into your daily speech. So you do that intensive program, that's where you get the initial skill set transferred, and then you practice it and practice it and practice it, and you go back and you have, as they do in Australia, review days where they review your skill, they monitor you, they check what you're doing. If you like, just fine tune it again, and then you go back out and you do it again. You've got to have a huge work ethic. You've got to be prepared to use the technique, which applies equally to stuttering modification as well, because obviously it doesn't matter how good the technique is, if you're not using it, it's pointless. So that's speech reconstruction. Stuttering modification is a different approach. The logic behind a stuttering modification treatment is rather that when you are approaching a word, and in our example again with the S words, where you block or you have repetitions and you don't control them. So for example, you go into a full block, which is like a seizure. Stuttering modification is saying, look, we're going to stutter, but we're going to control the stuttering. So we're actually going to take that pressure out, and we're going to be controlled in how we stutter, and we're going to maintain eye contact, and we're going to build that rapport with people. We're going to continue to build the rapport and be a communicator. So an example could be that you approach the word. So rather than just say Saturday, if Saturday was a word that you typically had trouble with, it would be Saturday is going to be a sunny day. So stuttering modification is about controlling the stutter. I feel like bringing the stutter back into your terms. Some real advantages with that. The advantages with that is that you're sort of aware of what's going on. Typically with an uncontrolled stutter, you shut your eyes. You're so focused on pushing the sound out, you don't know what's going on around you. So with a stuttering modification approach, you are aware and you can keep that eye contact and you can use those tools to build rapport. And then if you feel that you have more control over those situations, then you're less likely to be stressed and less likely to feel the anxiety that we all have as people who stutter, which can then make you feel more comfortable within yourself. And guess what? That means typically you don't stutter so much. The Maguire program, which is an internationally run organisation, which is run by stutterers, people who actually stutter, run the program as opposed to speech therapists. I would put their program under stuttering modification. They use a technique called coastal breathing, where they use their diaphragm. It's a little bit more confrontational than a lot of other stuttering modification treatments. And again, an example might be using our sentence, Saturday will be a sunny day. So again, it's treated a lot of people. A lot of people feel that it's a very good outcome for them and have seen a definite improvement in their fluency. So how do you go about deciding which of these is the best treatment for you? Again, it's research. It's about really getting into the online forums, finding people that ideally that have been through all different types, whether it be speech reconstruction or stuttering modification, finding out what they thought was good, what they thought was bad, understanding how that may best fit for you in terms of sustainability and carry over into your personal day-to-day life. And I think that that's the key aspect. Whatever you do, you have to feel comfortable with the treatment. You've got to feel comfortable with the technique. If you are going to use stuttering modification, are you going to really be able to do that in your life? If you can't, then look at speech reconstruction, because if you don't use it, there's no point in doing it. The other thing about choosing the treatment, and this applies for both reconstruction or stuttering modification, is your work ethic. You've got to really think about, do you really want to be fluent? Is it really that important to you? Are you prepared to do the work every day? Are you prepared to use the technique and push yourself, even though you may not be really comfortable? And these are the things that you've got to do. You've got to have that, it's like an athlete. You've got to have that skill and you've got to hone it and you've got to practice it. So how do you go about choosing a therapist? Well, there's a couple of things that I think you should really consider and think through before you engage. The first thing is be honest about where you are. So understand what stuttering means for you and be honest about everything that you've tried, everything that's worked, everything that hasn't worked. Be honest about your anxiety, and so that actually when you do engage with a speech therapist, you are giving them all of the relevant facts about where you are in your life, what stuttering means for you, what you've tried, what you know, what you think may work, what hasn't worked in the past, how anxious are you about speaking, and so forth. The other thing that you should think about when you engage is with the therapist, how knowledgeable are they specifically about stuttering? Not all speech therapists do stuttering. They do a wide range of other things, and they may only have a very limited exposure or experience in treating stuttering. So I really believe that you need to find a therapist who is a specialist in stuttering, who really understands it and can talk you through exactly what current best practice is in treatment and how they believe that that might be relevant and how that might be applied for you personally. And they need to be able to have that conversation with you. If they don't, then you run the risk of getting into a treatment program with a therapist who may not necessarily be the right person for you, and then you get through the treatment and you don't have an outcome and you won't go back to that treatment because you believe it's not going to work for you. When if you had engaged the treatment differently and you had a therapist that was a specialist, you may have had an entirely different outcome. The other thing to think through as well is that you don't necessarily have to be face-to-face with the therapist. You can have treatment over the phone, and there's a lot of evidence now to say that particularly Skype is is a very good tool in terms of achieving outcome. So, you may find a therapist that's in a different city, in a different state, even in a different country that can add a lot of value for you. All right, guys, have a think about that. If you want more detail, please go get a copy of Stutter Survival Guide 2. Have a look at the interview that I did with the Australian leading speech therapist. There's a lot of good stuff in there. And I'll be back to you real soon with my second video, which will be on building a fluency toolkit. Okay, great to talk to you. Look forward to talking to you real soon. Thank you. Oh, one last thing. If you like this video, please subscribe to my channel. Okay, talk soon.